coverage of the air bombing in Kaduna State. And joining us at this time is the Deputy Chief Medical Director, Barrow Dikko Teaching Hospital in Kaduna, Dr. Shoaib Musa. Thank you for joining us. And I'm just trying to imagine how it's been for you and your team since Sunday night when you've had to attend to victims of this unfortunate incident. What is the latest from there now?
Yes, thank you very much for having me. The latest is that
all right, appears there's some network issue there, but we'll try to reconnect with Dr. Shoaib Musa so we can get direct information from the hospital where the victims are being treated. All right, Dr. Musa, you were saying something about how it's been for you and your team managing the situation. What's the latest?
Yes, I was saying that we have had additional victims. A total of 81 have now been brought, out of which the latest ones that have been brought were children that were brought, whose parents were killed in the process, and then they've been brought. And so we are at the moment assessing them.
All right then. And what is the process of, assessment? And after the assessment, what happens? Who are they reunited with now that their parents are no longer here?
At the moment, we have a Ministry of Human Services. So they are there waiting for them to be adopted, and then we reunite them with maybe extended family members.
But Dr. Musa, do you actually have the capacity to attend to all of these victims that are being wheeled into your facility?
Yes, thank you very much for that. We don't have that facility. So it is because of that we had moved some to 44 hospital, Army Reference Hospital here in Kaduna. And we moved a total of 30 patients to that particular hospital. And we have also moved 7 of these patients to one DIV hospital, all in Kaduna here.
All right. And what has been the support you have been receiving from government, military authorities? Because in some quarter, they've promised to foot the medical bills of these victims.
Yes, the support of late has been tremendous, actually. Apart from their medical needs, which has been completely taken over by the state government, there is also their feeding, their clothing, and other essential needs. They've all been taken over by the government. And of course, I must mention that the Defense Ministry, through the Chief of Defense Staff, when they visited here, they came to our aids as well. And they are also providing for their medical needs.
Deputy Chief Medical Director, Barrow Dikko Teaching Hospital in Kaduna, Dr. Shoaib Musa, thank you very much for talking to us and for all you and your team have been doing to restore hope to these people.
Thank you very much for having me.